Hello, welcome to this episode of Pep Talk with Ada. Today we'll be talking about PTSD, post-traumatic stress disorder. We already started last week with phobia. I told you we'll be discussing about the 10 most popular psychological disorders. So if you're just joining us, you have to go and make reference to the previous video so you can be in line and in tune with what we are going to be discussing in today's video. I am Adaeze Onebunne, a mental health activist. Your mental health is my concern, so relax, let's get right into it.
Pep Talk with Ada.
PTSD, which is post-traumatic stress disorder, is our second in line after phobia. PTSD is a mental condition that can be developed after a person experiences or witnesses a traumatic event. This means that the incident doesn't have to happen to you personally, but you may witness it in order to develop a PTSD from that event. PTSD is characterized by the failure of recovering from a terrifying event, like I said, whether it happened to you or whether you experienced it. So far as you found it hard to recover from that particular incident, it can bring about PTSD. PTSD can last for months, it can last for years, and you can always overcome it. Phobia and PTSD is usually likened, but they are two different things. Why or how? Phobia is an intense fear for something, for an object, for a social situation. This fear, you don't know where it came from. You just realize that this situation fears you so badly. While PTSD on its own hand is from an experience. You must have come in contact with that kind of situation before, maybe as a child or at any point of your life. It is the way that incident occurred that gives you that post-traumatic stress disorder months or years after, because you can always flash back to that thing that happened to you before, and it makes you totally uncomfortable because you feel like you are in that situation again. That is the difference between phobia and PTSD. Okay, I'll share this story with you. This is something I experienced as a child, and at my age, it still gives me PTSD. When I was in primary 5, I moved to a new school, and one of the days while we were playing, two boys ran to me and put something inside my clothes. I thought it was a joke because I don't know these boys, and I just merely shrug off whatever it is they put in my clothes. Little did I know that these boys put ants in my clothes. You needed to see me that day. By the time the ants started biting me, all my body was full of bumps. You know, the way you feel the way your skin feels when you are bitten, by an ant or a mosquito, all over my body. But merely thinking about this encounter, it makes me really mad. So since then till now, I cannot stand ants. If I'm moving on any path that has maybe a farm around it or a bushy area, my eyes are always glued to the ground just so that I can see when ants are, this trail ants uses to pass, so that I can know when I come in contact with one so that I can avoid it. I hate ants. Mere looking at them makes me feel like they're all over my body. So this is an example of a post-traumatic stress disorder. You can see that it's from an event I experienced as a child that is still affecting me. So the way you will react as a normal human being to ants is not the way I will react when I see ants, because I've had an experience that it was really terrible. It was really terrible. So don't be surprised when I see ants and I'm acting all up. I am scared. I start breathing fast. I want to leave there instantly. You might think, what's this one doing? Please, you're doing too much. No, it is PTSD. It is as a result of a traumatic event that I experienced as a child that I have not healed from. It's been over 15 years and I still battle with that PTSD. As we get right to it, I want to use a few seconds to ask you to like this video and subscribe to this channel, because this channel is a channel that teaches you about mental health and your psychological wellness in all honesty. And I want you to subscribe so that when I drop a video, you'll be the first to watch it, like it, and share it. In that way, you'll be the first to know what it is talking about. I'm waiting for you to subscribe. Okay, if you have done that, I would like you to go to the comment section and let me know that you have subscribed so that I can give you a shout out in my next video. Thank you. We have a lot of traumatic events which are capable of getting people to have PTSD. So this kind of events include physical abuse or sexual abuse. Experiencing any sort of abuse, maybe as a child or at any point of your life, whether it's a one-time incident or an ongoing event, can cause PTSD. Most men or women who have been physically or sexually abused while they were growing up or at any point of their life find it really difficult to have intimacy or to enjoy sex with their partners going forward. They are traumatized with the events that happened to them. So whenever they try to make out with their current partners, you can see them having, shortage of breath, breathing really fast, crying, trembling. This is because their experiences when it comes to sex has not always been nice. It is a traumatic, or it was traumatic for them at that point. Most of them, it might have been their first experience, being raped. If you were disflowered through rape, even if it's not being disflowered through rape, so far as you were raped at any point of your life. In some people's cases, it changes their approach towards, things like sex. They start preying on young boys or on young girls, as the case may be. They start having some awkward fetish. They start wanting things that looks absurd or weird to a normal person, just like when a woman wants to go through pain, wants you to inflict pain on her. This might be as a result of the experience she had while growing up or at some point of her life. So she finds it really hard to get sexual pleasure if it is not coming that exact way of the abuse that she had in previous times, because it has messed up with her mental health. So it has to be a repetition of pattern for her to make sense of it. So I would actually advise you to seek for help. If you fall in this category or somebody that does, you can always reach out to me on Pep Talk with Ada on any social media platform, on Twitter, on Facebook, Beautiful Adaeze Onebunne, on IG, Pep Talk with Ada, on TikTok, Pep Talk with Ada. You can reach out to me and let me know your story. I promise that it is confidential and I will help you pull through. The next traumatic event that is capable of giving people PTSD is accident or life-threatening challenges. Being involved in a serious car accident, plane crash, train derailment, collapsing building can give you PTSD. I know of somebody who does not drive now at the moment because of an event that happened while she was on the highway. These things are serious and they affect our everyday life. So you need to be really attentive so you know when you are having these things, or when you are surrounded by somebody who is going through these things. I also know of someone who is not sure she's going to go through childbirth again, or she's so scared of getting pregnant, and her last child is over 7 years. Why? Because of what she encountered in the labor room. So whenever you have somebody like this around you, you need to be really patient with them and help them pull through. The third type of traumatic event that is capable of giving a person PTSD is childhood trauma. This is actually the basic of our event, because this is at the point where somebody is growing up as a child. As a child, enduring or witnessing abuse or neglect or any other traumatic experiences during childhood, such as domestic violence, the loss of a loved one, watching your parents get divorced, and all that then can mess up with your psychological wellness. I know you have learned something very tangible. Why not like this video and subscribe? That is, if you have not done that already. I intend to see you in the next video. Thank you. Bye.
Pep Talk with Ada.